Hi everybody, I'm Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. As a co-founder and co-chair of the Black Maternal Health Caucus, I am delighted to be joining you for this event, and I am grateful for your commitment to saving moms' lives and addressing birth equity for families across the United States. Our nation has the highest maternal mortality rate of any high-income country, and there are stark racial and ethnic disparities in outcomes. Black and Native moms are 2 to 4 times more likely to die from pregnancy-related complications than white moms, and Hispanic and AAPI people also experience elevated rates of maternal mortality and morbidity. Most alarming, outcomes are only getting worse. The number of maternal deaths in the United States in 2021 was nearly 80% higher than the number in 2018, and the maternal mortality rate increased by more than 50% for Black women and more than 100% for Hispanic women from 2019 to 2021. These statistics are tragic, but for many of us, this crisis isn't just about data, it's personal. In January 2017, I lost my friend, Dr. Shalon Irving, to pregnancy-related complications just 3 weeks after she gave birth to her first child, a beautiful daughter named Soleil. Shalon was a dual PhD CDC epidemiologist who served as a lieutenant commander in the Commissioned Corps of the U.S. Public Health Service. Yet as a Black woman, Shalon's level of educational attainment did not protect her when she got pregnant, nor did her social economic status or professional achievements. Instead, she became another devastating story of loss and a crisis filled with them. Causes of this crisis are multifaceted, including barriers to accessing perinatal care, social determinants of health, and maternal mental health conditions. But at its very core, this crisis and the disparities within it are fueled by racism within our healthcare system and throughout our society, racism that we must tackle head-on. To save our moms, to end these disparities, to ensure that pregnancy is not a time of fear, but an experience of joy for every family in this country, we must take bold action. That's why I'm proud to be the lead sponsor of a sweeping package of bills to address our nation's maternal mortality crisis, called the Black Maternal Health Momnibus Act, which builds on existing legislation to comprehensively address every driver of maternal mortality, morbidity, and disparities in America. The legislation includes investments to grow and diversify the perinatal workforce, improve data collection, fund community-based organizations, expand access to housing, nutrition, and healthy environments during and after pregnancy, and support moms with mental health conditions and substance use disorders. I was proud to introduce the Momnibus with then Senator, now Vice President Kamala Harris in 2020. And I'm thrilled to be partnering with her now to move these priorities forward. Last Congress, we saw real successes in this work. The first Momnibus bill, the Protecting Moms Who Served Act, was signed into law, providing funding that will ensure every veteran receives the high-quality maternal health care and robust support they need during and after pregnancy. Another Momnibus bill, the Maternal Vaccination Act, passed the House unanimously and would provide funding to establish a maternal vaccination awareness and equity campaign to protect moms and babies against vaccine-preventable diseases and reduce disparities in vaccination rates. We also secured significant funding increases for key maternal health programs, including the Improve Initiative, a program launched by the NIH in coordination with the Black Maternal Health Caucus to fund research on maternal mortality, morbidity, and disparities. We also secured investments in maternal health research at minority-serving institutions and funding specifically and exclusively for community-based organizations working to advance maternal health equity, provisions that came directly from the Momnibus. Other maternal health programs also saw significant funding increases, including maternal mortality review committees, perinatal quality collaboratives, and other critical initiatives at the CDC. This is historic progress, but there is so much more work that needs to be done. At the federal level, we need to pass the entire Momnibus, and we need to ensure that funding for key maternal health programs is distributed equitably, targeting the communities that need the money the most, through the organizations that are on the ground doing the work to save lives and improve outcomes. There are also critical steps that every state must take, beginning with extending postpartum Medicaid coverage from 60 days to 1 year, so that access to year-long postpartum coverage and care doesn't depend on what state you live in, but is available to every family in this country. And we need states to establish robust maternal mortality review committees, perinatal quality collaboratives, and other initiatives to target the unique drivers of maternal mortality and severe morbidity within each state. The call to action extends beyond government. Companies within the healthcare sector and beyond have already stepped up and made strong commitments to address our nation's maternal health crisis. Every private sector leader has the opportunity to do the same and to follow through on these commitments with meaningful actions through true partnerships with community-based organizations. And to every American who wants to get involved in this work, your advocacy at the local, state, and federal level, calling for change, pushing for the Momnibus and other necessary legislation, is more important now than ever. I'm grateful for the light that today's event is shining on maternal health in the United States, and I hope that it inspires everyone to take the action that we know is needed. Thank you for the opportunity to join you, and thank you for your commitment to this cause. I hope to see you in person soon, but until then, take good care of yourselves.